The Lexington Fayette County Health Department is today recommending that Fayette Countyans be vaccinated against hepatitis A, and that means that people who live in the county who are eligible to be vaccinated but have not yet received their vaccine series for hepatitis A or have not had hepatitis A infection in the past seek vaccination. And we're taking that next step for a couple of reasons. One is because we've had 12 cases now that have been reported to public health's attention of hepatitis A that are outbreak related to this current outbreak that's been going on of now over 1,600 cases in the state. And of those, 4 have been reported in the last 2 weeks. So we've had 12 cases, 4 in the last 2 weeks. And another reason is, if we look at the state's cases, and this is true of our own cases here in Fayette County, about 20% of those outbreak-related cases of hepatitis A do not have any known risk factors like illicit drug use or homelessness or incarceration. And so there is a concern of spread to the wider population beyond traditional risk groups. And this is a vaccine preventable disease. So this is a virus that's spread fecal orally. That means that if you're susceptible, that you're not immune, let's say, that you haven't been vaccinated or you haven't had the disease, then you touch something and you put something in your mouth that's contaminated, either contaminated food or contaminated drink that has been contaminated by particles from somebody who has been infected. So, and they shed those particles in their stool. It's a safe, effective vaccine. It has a good track record. In fact, after the first dose, 9 out of 10 people have immunogenicity or immunity to the virus. And as we talked about before, 20% of the cases that are being reported statewide have no obvious risk factor. So our concern is about spread to folks who aren't in traditional populations, as well as we will continue to very much focus on those who are in traditional populations and try to get them vaccinated.